Thanks for joining us today for Be Seen on Air. Today we're going to talk about wound care and hyperbaric medicine. And as we do that today, we have two different guests that are joining us. We have Dr. Troy Pascoe. Thank you, Dr. Pascoe, for joining us, as well as Catherine Stone, who is a program director. Both of them are with the wound care department there at Bronson Meadow Creek. Tell me kind of what your overall role is and what things you might do on the job there.
We treat not only wounds, but also disorders that may not necessarily come immediately to mind. For instance, we treat certain injuries or late effects of radiation with hyperbaric medicine, certain infections. So not necessarily wounds. Now, a very large bulk of the cases that we treat with hyperbaric medicine also concomitantly involve wounds, but not exclusively. Point is, if you have a young individual that scrapes their knee, for instance, and you expect it to heal within a matter of a few days, and it's 2 weeks and it still hasn't improved at all, that would be considered a wound that we could help. An idea of what we use hyperbaric for are diabetic foot ulcers. For instance, a patient that has a foot ulcer that is just not healing with all of the other, good nutrition, they're following their wound care plan, it's just not healing, and sometimes it's just that final piece of the puzzle that gets them to heal, and it may be healing an ulcer that otherwise, without, they may have to undergo an amputation or something like that. Those are the particular warding cases. But I mentioned diabetic foot ulcers. Some of the other common things that we would treat is bone infections, for instance. Bone infections that can't be easily cleared by antibiotics alone. I mentioned radiation. We know that's an extremely valuable tool in our battle against cancer. And we are getting better and better at, I think, our radiation devices and how we deliver it.
So patients can call at any time and refer themselves. As of right now, we are one of the only specialties that does not require a physician referral. So that is very nice for those patients. We do get many referrals from the local providers. And usually it's just a phone call, or sometimes they fax our referral form over just to get it to our office coordinator, and then usually within a week we have them in the department being treated by one of our providers. And Shannon, our office coordinator, is really good about getting them in right away as soon as we can.